fear number 13, can't get numb. We do see some patients that do take a little longer to anaesthetise, to numb up before we start their dental treatment. With these patients, you know, they usually have a history going by, and for these patients we book off, you know, some longer time to be able to do that. But it's very, very rare that that's the case. The main reasons that people won't numb are due to localised effects, due to there's some infection present that needs to be treated with some antibiotics before we can numb the patient up to have some treatment. Maybe with some student dentists or newly qualified dentists, poor technique may be a factor, as well as anatomical variation in patients. For the majority of patients, that's not really a problem, but you know, usually these patients have a bit of a history of failed anaesthesia. In this practice we use the quick sleeper, which is a local acting anaesthetic that can numb even the most infected of teeth, and because it's locally acting, it doesn't need to take into account any anatomical variation, which can be a particular problem on occasion for some patients when they're having their lower teeth numbed. Red hair, anxiety, certain syndromes can play a part, particularly anxiety. Patients who are numb reporting that they're not. There is a difference in, you know, that they don't feel any pain when they have their treatment carried out, but they can, you know, have a tooth removed, they may feel a bit of pressure, a bit of pushing, unless it's explained to the patient, particularly the anxious ones, that they will experience the sensation of pressure, pushing, but nothing should feel sharp or painful at any time. And you know, these patients are numb, but may report a bit, you know, that it is painful. It's really down to their anxiety, and what we need to look to do is find a different method, most commonly some form of sedation, to be able to treat these patients.